Welcome to Frost and Sullivan's Growth Podcast. This series brings together key insights from our research, growth analyses, and thought leadership, highlighting the strategic imperatives shaping industries, technologies, and markets worldwide. In this episode, we explore AI-driven simulation modeling in healthcare, examining how predictive virtual environments are enabling better clinical training, operational planning, and decision-making across increasingly complex healthcare systems.
Healthcare complexity is driving the need for predictive simulation. Healthcare systems are operating in a more complex environment than ever before. Rising patient volumes, expanding clinical data, and evolving treatment protocols are putting pressure on hospitals, clinicians, and operational infrastructure. Traditional physical simulation environments are often expensive, difficult to scale, and limited in their ability to replicate rare clinical events or complex operational scenarios. Artificial intelligence-based simulation modeling addresses these limitations by creating dynamic, data-driven virtual environments. These environments allow healthcare organizations to simulate surgical procedures, evaluate clinical workflows, and test operational strategies before implementing them in real care settings. By predicting outcomes and identifying risks in advance, AI-driven simulation helps improve clinical preparedness and optimize healthcare resource allocation. How is your organization leveraging predictive simulation to improve clinical readiness and operational decision-making?
Technological capabilities are enabling advanced healthcare simulations. Several technological capabilities are accelerating the adoption of AI-based simulation modeling. Artificial intelligence enables predictive insights by analyzing clinical and operational data to forecast outcomes and guide proactive decisions. Advanced modeling techniques support scalable simulations capable of running complex healthcare scenarios with improved accuracy and reduced computational costs. Modern simulation environments also integrate multimodal data sources such as medical imaging, clinical records, and Internet of Things device data to replicate real healthcare systems. Machine learning further enables continuous learning within simulation models, allowing them to adapt as new data becomes available, while automated algorithms optimize and refine simulation scenarios. These capabilities are transforming simulation from a static training tool into a dynamic decision support platform. Are your simulation environments equipped to incorporate real-time clinical data and predictive analytics?
Strategic imperatives are accelerating AI-driven simulation adoption. Several strategic imperatives are shaping the adoption of simulation technologies across healthcare. Rising healthcare complexity, aging populations, and increasing chronic disease burdens are intensifying demand for scalable training and operational planning tools. Workforce shortages are also driving the need for more efficient clinician training environments. At the same time, disruptive technologies such as augmented reality, virtual reality, robotics, artificial intelligence, and digital twins are enabling immersive simulation platforms that support surgical training, diagnostics, and hospital workflow planning. Industry convergence is further accelerating innovation. Collaboration between technology providers, hospitals, medical device companies, and cloud providers is enabling access to larger datasets and advanced computing capabilities required to develop sophisticated simulation models. How are cross-industry partnerships influencing your healthcare simulation strategy?
From engineering simulations to digital twins in healthcare, simulation modeling has evolved significantly over the past several decades. Early simulation systems were used primarily for narrow engineering problems and required specialized expertise. Over time, simulation tools expanded into design and engineering analysis across multiple industries. By the early 2000s, simulation-based system design enabled modeling across complex multidisciplinary environments. More recently, digital twins have emerged as a powerful capability linking virtual models with real-time operational data to generate predictive insights. In healthcare, digital twins are enabling hospitals to model patient care pathways, predict operational bottlenecks, and optimize clinical workflows using real-world data. This evolution is transforming simulation into a foundational technology for predictive healthcare systems. How prepared is your organization to integrate digital twin capabilities into healthcare planning and operations?
Growth Opportunity Spotlight, Intelligent Clinical Training and Decision Simulation. Emerging innovations in artificial intelligence are expanding the role of simulation in clinical training and healthcare decision-making. Machine learning is enabling adaptive training environments that adjust simulation scenarios based on clinical data and learner performance. Deep learning technologies are advancing imaging simulation and robotic surgery training platforms. Reinforcement learning is also enabling treatment modeling and care decision simulations within virtual environments. Organizations such as MedicineTech, HIP AI, Direct Organs, and Senhance Surgical System are advancing simulation capabilities across clinical training, imaging, and robotic surgery environments. These developments are enabling healthcare providers to train clinicians more effectively, simulate complex treatment scenarios, and improve patient outcomes through predictive decision-making. How can AI-driven simulation technologies strengthen clinical training, treatment planning, and healthcare system performance?
That's all for this episode of Frost and Sullivan's Growth Podcast. For deeper analysis, research insights, and strategic frameworks shaping future growth, explore our studies and resources at frost.com or reach out to our team at hello@frost.com. We'll be back soon with more perspectives to help you stay clear-headed and growth-ready.